All right, let's dive into the fascinating world of anatomy. Have you ever thought you knew all the bones in the skull? Well, think again. Today, we're going to uncover the surprising truth about the parietal bone. Now, let's address a common misconception about the parietal bone. Many believe it's located in a specific area of the skull, but the reality might shock you. Imagine the confusion caused by the name parietal bone and how it relates to the skull. It's time to unravel this mystery and set the record straight. Let's take a trip back in time to understand why the parietal bone was named as such and how this has led to widespread misunderstanding in the field of anatomy. The parietal bone is one of the 8 of cranial bones. It forms the skull or the cranium, part of our head, and classified as axial skeleton of our skeletal system. Quick facts: location neurocranium, bone type flat bone. Parts of parietal bone. The frontal angle of parietal bone is the area of the bone where its frontal and sagittal borders meet. It is located at the bregma and is one of the 4 angles of the parietal bone, the other 3 being the occipital, mastoid, and sphenoidal angles. The mastoid angle of parietal bone is the area of the bone where its occipital and squamosal borders meet. It is located at the pterion and is one of the 4 angles of the parietal bone, the other 3 being the frontal, occipital, and sphenoidal angles. The occipital angle of parietal bone is the area of the bone where its sagittal and occipital borders meet. It is located at the lambda and is one of the 4 angles of the parietal bone, the other 3 being the frontal, mastoid, and sphenoidal angles. The sphenoidal angle of parietal bone is the area of the bone where its squamosal and frontal borders meet. It is located at the pterion and is one of the 4 angles of the parietal bone, the other 3 being the frontal, occipital, and mastoid angles. The parietal foramen is a small, round opening found along the posteromedial area of each parietal bone. Specifically, it is located medial to a parietal eminence and lateral to the sagittal suture and obelion. The parietal foramen allows for the passage of the parietal emissary vein ... In some individuals, the parietal foramen may only be present on one side or may be absent bilaterally. Surfaces of parietal bone. The external surface, also called ectocranial surface, is the convex area on the outer aspect of the parietal bone. It is one of 2 surfaces of the parietal bone, the other being the internal surface. The external surface of parietal bone consists of the parietal eminence, superior and inferior temporal lines, posterosuperior portion of the temporal fossa ... It provides an origin site for the temporalis muscle and an attachment site for the temporal fascia. The sagittal border is the serrated, superiorly located margin of the parietal bone. It is one of the 4 borders of the parietal bone, the other 3 being the occipital, squamosal, and frontal borders. The sagittal border of parietal bone articulates with the sagittal border of the opposite parietal bone, forming the sagittal suture. The middle portion of the groove for the superior sagittal sinus is found along the internal surface of the sagittal border of parietal bone. The occipital border is the denticulated, posteriorly located margin of the parietal bone. It is one of the 4 borders of the parietal bone, the other 3 being the sagittal, squamosal, and frontal borders. The occipital border of parietal bone articulates with the lambdoid border of the occipital bone, forming the lambdoid suture. The squamosal border is the beveled, inferiorly located margin of the parietal bone. It is one of the 4 borders of the parietal bone, the other 3 being the sagittal, occipital, and frontal borders. The squamosal border of parietal bone articulates with the parietal margin of the greater wing of sphenoid bone, forming the sphenoparietal suture. Parietal border of the squamous part of temporal bone, forming the squamous suture. Mastoid part of the temporal bone, forming the parietomastoid suture. The internal surface, also called endocranial surface, is the concave area on the inner aspect of the parietal bone. The internal surface of parietal bone consists of grooves for both the sigmoid and superior sagittal sinuses, grooves for adjacent middle meningeal vessels. A T provides an attachment site for the falx cerebri. To sum up, the parietal bone is a vital part of the human skull with significant roles in protection, structure, and function. Its understanding is crucial for both anatomical knowledge and clinical practice. Before we wrap up, I want to encourage you to share your thoughts on this topic in the comments section below. Don't forget to subscribe for more mind-blowing anatomy facts and updates on our latest videos. Thanks for joining me on this brain-expanding journey. Stay curious and keep exploring the wonders of the human body. See you in the next video.